We have a really great news update tonight on a 38-year-old mom of two with colon cancer. Earlier this year, we introduced you to Nicole Maier, a Treasure Coast woman who started having stomach cramping last fall. She almost ignored those signs and symptoms, but a check-in with her doctor prompted an early colonoscopy that came with a shocking diagnosis: colon cancer at 38 years young and no family history. I got the chance to check in with Nicole via Zoom this week. Great news. Her recent testing found what's called NED, or no evidence of disease. The margins on her last test came back clean. So, of course, she and her family and her doctors are celebrating tonight. Insurance companies, of course, they start to cover colonoscopies between 45 and 50 years old. But more and more these days, adults younger than that are starting to present with colon cancer. New tests have been approved just recently that can really help with early detection, and several other breakthroughs in colon cancer research are encouraging to patients like Nicole.
To know that research is still going into this and finding something new every day, and there's new testing for it, it gives me a lot of hope that, anybody else in my position can find it quicker and start treating faster. And it gives me hope that new tests are being found out every day. And yeah, sorry, try not to get emotional, but
the first thought in a 38-year-old is not colon cancer, it's colitis, inflammatory disease. Fortunately, she followed up, had her colonoscopy, and was diagnosed.
That was Dr. Adam Curtin there. He was Nicole's surgeon at HCA St. Lucie Hospital. So here are those signs and symptoms that you should be watching out for always: a change in bowel habits, blood in or on your stool, diarrhea, chronic, constipation, chronic, or the feeling that the bowel just doesn't empty all the way. Also abdominal pain, which Nicole had, aches or cramps that just don't go away. And then, of course, weight loss when you're not really trying to lose weight. They call colon cancer the silent killer because usually you don't find out about it until it's maybe stage 3 or more. So early detection is really key. If you have any of those signs and symptoms, reach out to your physician, your family doctor. As for Nicole, every 3 months moving forward, she'll get blood work just to keep an eye on things, and then she'll have those annual PET scans as well as annual colonoscopies moving forward as well.